Video lecture chapter 19, Paralleling Technique, Dental Radiography, Principles and Techniques. Basic concepts. Paralleling technique is also known as extension cone paralleling technique, right angle technique, or long cone technique. Some terminology used: parallel, intersecting, perpendicular, right angle, long axis of the tooth, and central ray. Principles of paralleling technique. The receptor is placed in the mouth parallel to the long axis of the tooth being radiographed. The central ray of the X-ray beam is directed perpendicular to the film and the long axis of the tooth. A beam alignment device must be used to keep the receptor parallel with the long axis of the tooth. Object receptor distance must be increased to keep the receptor parallel with the long axis of the tooth, and target receptor distance must be increased to ensure that only the most parallel rays will be directed to the tooth. Beam alignment devices and receptor holding devices. Just a device used to position the receptor in the mouth and retain the receptor in position during exposure. Examples of commercially available intraoral beam alignment devices include RIN and the state bite block. The RIN XCP extension cone paralleling system is 3 plastic bite blocks along with aiming rings and indicator arms. With the RIN XCP ORA, we have 1 ring and an arm positioning system. More receptor holding devices include the universal sensor holder, the flip ray system, and the snap array holder. Receptors used for paralleling technique include size 1 receptor used in the anterior region, the long portion of the vertical direction, and size 2 receptor used in the posterior region with the long portion in the horizontal direction. Rules for paralleling technique include receptor placement, position, vertical angulation and horizontal angulation, and film receptor exposure. Step-by-step procedures include patient preparation, equipment preparation, exposure sequence for receptor placements, receptor placement for paralleling technique. Patient preparation procedure, we would explain the procedure to our patient, adjust their chair and their headrest, place and secure the lead apron, and remove all objects from the mouth. For equipment preparation, we would set the exposure control factors, open the sterilized package containing the beam alignment devices, and then assemble the device over a covered work area. Exposure sequence for receptor placements. Anterior exposure sequence, size 1, receptor is small for ease for patient. This is less likely to cause the patient to gag. A total of 7 anterior placements using the size 1 receptor, 4 maxillary and 3 mandibular. Posterior exposure sequence includes 8 posterior placements, 4 of the maxillary and 4 of the mandibular. Receptor placement for paralleling technique. The specific area where the receptor must be positioned before exposure is dictated by teeth and surrounding structures. Modifications in paralleling technique. If the patient maybe has a shallow palate, any bony growth, or mandibular premolar region. With a shallow palate, we can use cotton rolls. So 2 cotton rolls can be used, one placed on each side of the bite block. Vertical angulation can be increased by 5 to 15 degrees. For bony growths, maxillary tori, the receptor must be placed on the far side of the torus, then exposed. For mandibular, the receptor must be placed between the tori and the tongue, then exposed. Mandibular premolar region, receptor placement, the receptor must be placed under the tongue. Film, the lower edge of the film can be gently softened to prevent discomfort. Advantages and disadvantages. Advantages of paralleling technique and disadvantages of paralleling technique. Advantages include accuracy, the image is free of distortion. Simplicity, it eliminates the need to determine horizontal and vertical angulation and eliminates chances of dimensional distortion. And duplication, comparison of serial images has great validity. Disadvantages include receptor placement may be difficult and discomfort may be uncomfortable for some patients. This concludes our lecture.